As everybody in this room, I believe, is well aware, the rates of obesity across all segments of the adult population have really skyrocketed over the past 3 decades. You can just see the trajectories. And it doesn't matter if we're talking about younger adults below the age of 39, middle-aged adults, or older adults. And it's obviously very concerning because we know the metabolic damage that carrying excess body fat can have on a person. The next slide I'll show you just highlights some of the metabolic dysregulation that can occur with obesity. And as you can see, over time, leptin resistance can start to develop. And when that starts to develop, it can dysregulate food intake, which can then subsequently lead to a reduction. Let me go back. Subsequently lead to a reduction in ghrelin, which over time can reduce growth hormone and have this effect of preventing lipid mobilization, ultimately back to contributing to hormonal imbalances in a feed-forward cycle where food intake remains dysregulated and a person is never able to switch into a fat-burning state, so to speak. And I think this is one of the reasons why we see a progressive increase in weight gain once metabolic regulation is disrupted. We also know that stress, chronic stress, can have a significant negative influence on energy metabolism. And ultimately that can start to contribute to epigenetic modifications. In addition to the effect excess weight can have on appetite regulation, chronic stress can dysregulate appetite and lead to a excessive ingestion of highly palatable food. And that when this stress combines with negative behavior patterns, ultimately increased adiposity can occur and lead to a reduction in immune response, which I think is one of the reasons why we often see that individuals with metabolic dysregulation are at increased risk of many diseases, including COVID-19. Now, unfortunately, even if a person doesn't gain a sufficient amount of weight to be considered having to have obesity, with aging, what we often see is a change in body composition such that the same individual at the same height and weight would have a significantly different body composition at age 70 than they would at age 25. This represents the same person, a hypothetical, who at age 25 would only have 14% of their total body composition comprised of body fat, whereas at age 70, now that body composition has changed to 30% with a corresponding reduction in lean mass. And this can set an individual up for a host of metabolic diseases. With the reduction in muscle tissue comes also reduced oxidative capacity. And as the lipid storage capacity becomes saturated, what can happen is the lipid droplets have to go somewhere in the body. And unfortunately, they start to surround the vital organs, including the muscle. And so that can compromise the function of the muscle and contribute to a reduction in energy expenditure as we age. And of course, the reduction in metabolic rate can predispose individuals to weight gain over time. But more importantly, what can happen is with age, what we see is a progressive increase in the prevalence of metabolic syndrome. What you can see here, when individuals are considered young before the age of 30, the prevalence of the metabolic syndrome, and this is in the United States, is relatively low. But by the time individuals are between the ages of 30 to 49, you see almost 25% of the population, or even higher, would be diagnosed as having the metabolic syndrome, with that rate progressively increasing to almost 50% when individuals are between the ages of 50 to 69, and over half of individuals 70 years and older have the metabolic syndrome. And as you're well aware, it's comprised of the following metabolic risk factors. When an individual has 3 or more of these risk factors, they're considered to have the metabolic syndrome. It's obviously a concern because of the association with chronic disease conditions as well as mortality. So what are some of the mechanisms through which both obesity and diabetes can accelerate the decline in function? In this slide, I'd like to show the contribution of obesity contributing to intramuscular adipose tissue, as well as pro-inflammatory cytokines, cortisol, and of course fat mass, which can lead to a reduction in the strength to muscle mass ratio, with diabetes also contributing to intramuscular adipose tissue, but also affecting anabolic hormones, decline in mitochondrial function, as well as neural function. And together, those both can contribute to a reduction in the strength to total body mass ratio, which obviously would increase risk of functional decline. Oops. So this was a great article, I thought, by one of my colleagues, Mark Mattson, that highlights that metabolic states are not just in the periphery, but that our metabolic health influences every organ, including our brain. And so there's this clear connection between our state of metabolic health and our brain function or brain rate of aging. And so this was a nice figure, I thought, from that article that shows that dysregulated energy metabolism is at the heart of all of the mechanisms that we know contribute to brain aging. I won't read them, but you can just see the different mechanisms. And dysregulated energy metabolism affects each and every one of these mechanisms. And a more easier to understand way of thinking about this relationship would be this slide, where you see that there's this clear connection between metabolic syndrome, aging, and levels of oxidative stress. So in this slide, what we can see is, what this author concluded was inadequate lifestyle marked by high levels of sedentary behavior, unhealthy calorie intake, and frequent food consumption can contribute to elevated levels of reactive oxygen species, which can affect many of the metabolic risk factors that we know and ultimately contribute to metabolic syndrome, which with aging can also accelerate the levels of reactive oxygen species. Thank you. And so there's this complex relationship between our lifestyle, our rate of aging, and our metabolic health. One of the things that I thought would be interesting to do, and with help from a good friend, I was able to put together this interesting connection between lifestyle factors, nutritional and exercise related factors that contribute to both insulin resistance as well as sarcopenia. Again, sarcopenia is the loss of muscle that occurs with aging. And what you can see here is there's pretty strong evidence for a high fat, high saturated fat diet contributing to insulin resistance. And there's pretty strong evidence for a low protein diet contributing to sarcopenia. But for everything else, dietary wise, the level of evidence for sarcopenia is only limited. With insulin resistance, we also see high glycemic meals and high levels of refined sugars and low salt or excessively low salt intake contributing to insulin resistance. But what both share in common is a sedentary lifestyle, to highlight the importance of movement throughout the day as being an important factor for both metabolic health as well as muscle quality. Okay, so to move forward, that was the part of this presentation that depicts the problem that we're up against. And now getting into the potential solutions, which I think is much more enjoyable to talk about. Okay. So when we think about our ultimate goal, when we're working with people, in my mind, it's to promote wellness. And mobility as we age is a critical factor in promoting wellness. Some of the factors that we study at the Institute on Aging that we know affect a person's mobility and level of wellness over time include their metabolic flexibility, levels of pain, strength to body mass ratio, body fat accumulation, and cognitive decline. And of course, none of these factors happen in a vacuum. They happen during aging, influenced by the environment, influenced by social cultural factors, as well as mental health. We've all been through a very strange time in history with the pandemic, and we know how that could have affected our levels of activity throughout the day, or it could have affected our food intake, or both. And many people respond differently, but certainly social cultural factors play a significant role in what we choose to do. From an activity standpoint, what we know contributes to many of these risk factors is a sedentary lifestyle, which is marked by high levels of TV watching, computer time, and then limited life space, which again, many of us were forced to have limited life space due to the pandemic. But the choice of leisure time exercise is something that many people unfortunately choose not to engage in leisure time exercise. And in this day and age, we really do have a choice, because with our technological advances, it's become much easier to live without having to move about during the day. So what do we consider from a physical activity standpoint? What I think is important to consider is intermittent activity bouts throughout the day. So this is distinct from aerobic exercise or flexibility exercise or resisted training. This would be actually getting up and moving every hour for a few minutes, because we know that prolonged periods of sedentary lifestyle can have metabolic consequences. From a dietary standpoint, excessive calorie intake, unhealthy fats, high sodium intake, added sugar consumption, and undernutrition all can contribute to the unhealthy changes in metabolism. So what are some of the dietary interventions? And this is where we're going to focus the remainder of this talk. What we'll obviously talk through a bit is intermittent fasting, but a very popular diet now is the ketogenic diet. Calorie restriction, meal replacements, and ketone supplements are all potential solutions for us to consider. This comes from an article that I considered to be a great review of the literature on the influence of meal timing and frequency on health in humans, and highlighting the role of fasting. And there's a particular figure from the article that I wanted to show you, because I think it tells a nice story. What you can see from this figure is that fasting, calorie restriction, and a ketogenic diet all have evidence to support their effects on the key hallmarks of aging, of biological aging, okay? The length of these arrows depicts the strength of the evidence from the literature. And so you can see that they all can affect levels of inflammation by lowering levels of inflammation in the body. They all can affect levels of reactive oxygen species in the blood, with fasting having a larger effect than calorie restriction or even the ketogenic diet. They all can affect levels of autophagy, which is the mechanisms our cells use to clean themselves or remove waste products. And what you can see is the strength of evidence is pretty clear that fasting has the largest effect compared to the other two. They all can affect levels of mitochondrial biogenesis, or the creation of new mitochondria. They all can affect our immune system function, which is very important nowadays. They can all reduce levels of growth hormone, or IGF-1, in a way that has been associated with greater lifespan. And they can also affect the microbiome. And then it comes to my favorite hypothesis, which is hormesis. And has anyone, well, I won't ask because I know many people are on Zoom, heard of the term hormesis, which is the concept that there's an optimal level of stress, that when our cells are exposed to this level of stress, that activates DNA repair pathways, and our cells ultimately become more resilient and resistant to stress. Of course, chronic stress is not the same as acute or short-term stress. And so all of these have the ability to provide what I consider a short-term metabolic stress that ultimately activates DNA repair genes and increases our cells' resistance to stress. Now, this slide is put in here to to indicate it's not just our lifestyle that can activate the hormetic response, but certainly certain phytochemicals as well as drugs or other nutrients can also activate the hormetic response and lead to basically greater resistance to disease. But tonight the focus won't be on phytochemicals. I just wanted to highlight that. Rather, what we want to focus in on tonight is the role that intermittent fasting can have on our organ health. And what you can see from this slide is that from head to toe, intermittent fasting has beneficial effects on our body. I won't read each of the benefits, but you can just see how it can have a profound benefit on our overall organ health, and that leads to a profound benefit on our metabolic health, and ultimately, ideally, our functional lifespan. Now, many people wonder what intermittent fasting means. Actually, when I think of the term intermittent fasting, I think of it as similar to the term exercise. It can mean a lot of different things. The truth is we all practice intermittent fasting every night when we sleep. Unless you wake up during the night to eat, you're fasting while you're sleeping. But in general, what intermittent fasting means is an eating pattern in which no or few calories are consumed for a time period that can range for 12 hours or longer. There's at least two popular types that we'll focus in on, and those are time-restricted eating and alternate day fasting. And I think the next slide will highlight what those look like. So in this slide, this depicts a typical American eating pattern, where their first meal would occur at 7 a.m. And after that first meal, the levels of glucose would rise until about 12 p.m. when the second meal would occur. And then the levels of glucose would rise again until about 6 p.m. when the third meal would occur, until about 8 p.m. when dessert or later snack would occur. And then they would fall asleep and levels of glucose would go down. And then that pattern would repeat itself again, over and over. And what you notice here is levels of ketones in the blood never increase with the typical American eating pattern. In contrast with example of an alternate day intermittent fasting or a 5-2 intermittent fasting program where 2 days a week a person practices a fasting approach and 5 days a week they consume food normally, what you can see is on the fasting day, the levels of ketones would actually go up dramatically until the next day at 7 a.m. when they have their first meal, at which time the body would shift back into you running off glucose as the primary source of energy. So this would represent alternate day intermittent fasting regimen. In contrast here, the lower slide, panel C, would represent time-restricted eating pattern where the metabolic switch, what we call, is flipped every day. And so in this case, the first meal would occur at approximately 2 p.m. And at that point, you can see there was a small increase in levels of the ketones in the blood. And then at 2 p.m., when the first meal occurs, the body would switch back to using glucose as a primary source of energy. At 5 p.m., the second meal would occur, switch back to using glucose. And then at 8 p.m., the final meal would occur. And that pattern would repeat itself over and over, where the eating period would occur over 6 hours and the fasting period would be 18 hours each day. And that's in marked contrast to the way that most people consume food, where food is consumed for usually 14 hours approximately each day. All right, so we're going to come back to intermittent fasting, but I first want to compare and contrast it a little bit with calorie restriction. And I call this the good, the bad, and the frustrating part of calorie restriction. So probably everyone in here knows that calorie restriction diets are associated with greater lifespan in humans. You can see from this slide that in countries in which food consumption is the lowest, lifespan is the greatest. And even in islands off of Japan, Okinawa, you can see that the lifespan among those individuals is even higher than among individuals in Japan. followed by Sweden, followed by the USA. So does that mean that calorie restriction is clearly the way to extend our lifespan in humans? The answer is not necessarily, but it's certainly intriguing that the individuals in these populations who consume the fewest calories had the greatest lifespan extension. In preclinical studies, over and over again, we see that rodents or other shorter-lived species who engage in calorie restriction had longer lifespans and longer lifespans that are healthy. So they were disease-free for much longer periods of time. Now, in the next slide, I want to show you work that I was involved in 2 human studies involving calorie restriction. First. Okay, so in this panel, this comes from a 6-month human study in which we randomly assigned participants who were overweight but otherwise healthy to one of 4 conditions: a healthy American Heart Association diet, calorie restriction, which was 25% calorie restriction from their baseline energy expenditure, calorie restriction plus physical activity, which was a 25% energy deficit achieved from a combination of calorie restriction plus physical activity, or a low-calorie diet in which they lost weight for approximately 12 weeks because they consumed only 890 calories for a 12-week period until they lost about 15% of their initial body weight, at which point they were clamped and maintained on that weight loss. And what you can see is our measure of DNA fragmentation, an indication of the cellular health, was dramatically improved. There was less DNA fragmentation, less DNA damage following 6 months of calorie restriction, or calorie restriction plus physical activity, or a low-calorie diet. In the American Heart Association diet, the trend was in the right direction, but it wasn't statistically significant. Now, what stood out to me from this was not only the reduction in DNA damage, but also the fact that in both groups, that achieved this energy deficit of 25%, one group achieved this energy deficit with a 12.5% energy reduction through calorie restriction, and the other through a 25% calorie restriction energy deficit. So that suggested to me that it wasn't calorie restriction per se that was responsible for the beneficial changes in DNA damage as much as it was the energy deficit, the total energy deficit that was produced by this combination. So that led to the idea that we should test this hypothesis in a follow-up study. And this was in individuals 50 to 60 years of age, which we followed for 1 year. And we had them achieve an energy deficit through either 20% calorie reduction or a 20% increase in their physical activity with their calorie intake maintained. So they both produced a 20% energy deficit. One produced it through calorie restriction, one produced it through increased levels of physical activity. And what you see here is that in both cases, there was reduction in damage to both oxidized DNA and oxidized RNA, both achieved through the energy deficit, which was either achieved through exercise or through calorie restriction. So that got me thinking even more that maybe it's not calorie restriction per se, but it's the energy deficit that leads to these beneficial changes at the cellular level and potentially functional changes over time. So we'll come back to that shortly. So before we come to this discussion about the potential role of intermittent fasting, I wanted to bring up something that probably every practitioner has experienced, which is the frustrating side of calorie restriction. We know that calorie restriction can improve many biological parameters, but we also know that with weight loss, there's a corresponding loss of fat-free mass, and that can lead to a slowing of metabolic rate, which can predispose individuals to weight gain. And we also know that the reduction in metabolic rate following calorie restriction is even greater than you would predict for the loss of metabolic body mass. And so that can make it really difficult for individuals to maintain calorie restriction over long periods of time, because the level at which they would have to maintain that calorie restriction is even greater than you would expect it to be. And not surprisingly, we know that long-term adherence to calorie restriction is notoriously low. Very few people are successful at long-term weight loss maintenance for some of these reasons that I mentioned here. Now, I thought before we look into other alternatives, maybe somebody's discovered the perfect diet. And so I thought, let's look in the literature and see what is known about some of the popular diets. And this is an older study at this point, but the main point of this study is that it looked at 4 different types of diets. And these were diets that were popular maybe 15 years ago. Some of them still are. The Atkins diet, the Zone diet, the Weight Watchers diet, and the Ornish diet. The main point of this slide is that over the course of 1 year, what you can see in all 4 cases is that the metric that they used to measure adherence clearly progressively declined over the course of 1 year in all 4 of these dietary conditions. So that suggested to me that there really isn't this magical diet that is just easy for people to follow, or if there is, it's not one of these 4 diets. And unfortunately, what we see over and over, this was an older review, but this pattern of weight loss followed by weight regain is something that is pretty consistently shown with approximately 95% of individuals who lose weight successfully over the course of 6 months, generally speaking. By the end of 4 to 5 years, 95% of individuals have regained most of the weight that was lost. So I wanted to take a moment to talk about that and talk about why is it so difficult to maintain lost weight. Let's talk about that. So from a biological standpoint, there's a few biological factors. Clearly, as I mentioned, there's a reduction in energy needs due to the corresponding reduction in metabolic rate that occurs after calorie restriction. And I mentioned that. And that can prime an individual for regain. In addition to the reduction in metabolic rate, levels of hunger don't unfortunately reduce in a similar manner as the reduction in metabolic rate. So levels of hunger stay relatively high, but levels of metabolism go down. Then there's environmental factors. It doesn't really matter where we live. We're constantly exposed to very low, relatively low cost, highly palatable, energy-dense foods, which can make it very difficult because there's studies to show that the palatability of food actually goes up following a weight loss. And then there's some of the challenges that we all experience, which is barriers to finding time to exercise. And when an individual who has lost weight doesn't find time to exercise, that means their total energy expenditure is lower than they need it to be to maintain the weight loss. And this can prime an individual for a slip or a lapse. Of course, then there's the psychological factors. Many people who enter behavioral weight loss treatment have unrealistic expectations of the amount of weight loss they'll lose, the impact of the loss on their overall health, well-being, what they'll experience socially, and the amount of effort that's required to achieve the loss. And so usually what happens is at the end of 6 months of a lifestyle treatment, people come out disappointed, and that can lead to discouragement. There's also a lack of reinforcement for weight loss maintenance. Very few people are told, you're doing a great job maintaining your weight loss. They're only told that they are doing a great job when they have initial weight loss. And so finally, individuals fail to acquire maintenance skills, skills needed to maintain their behavior over the long term. And so there becomes an unfavorable cost-benefit ratio. And this unfavorable cost-benefit ratio can lead to discouragement and ultimately abandonment of weight control efforts. So these are some of the reasons why I started to think we really need to look into novel approaches to help people with metabolic disease conditions be able to maintain behavior change. So what are some of the novel approaches that we might want to consider? one of the factors that I think we should talk about a little bit is what happens in postprandial states. We ultimately want individuals to stay in a healthy postprandial state, but when there's long-term compliance with calorie restriction is poor, it's difficult for individuals to stay in that healthy postprandial state long-term. And so I started to think, what are some alternative options for individuals? And that led to an undertaking that started about 5 years ago, where I had the idea that what is the evidence out there in the literature for the benefits of fasting on changes in body composition during weight loss? And we entitled this article, Flipping the Metabolic Switch, Understanding and Applying the Health Benefits of Fasting. And so what I'll do is just kind of show you the main findings of this review, which was about a 2-year effort. So this slide represents a lot of time and energy, but I will do my best to tell you about it. On the top panel, what you can see is the findings of time-restricted feeding studies. There was 4 at the time of our review, and then there was 1 that was done after our review. And what you can see is the blue line represents loss of body fat, and in 4 out of the 5 studies, there was a significant loss of body fat. In none of these 5 studies was there a significant loss of lean mass. So that was a relatively exciting finding for the reasons I mentioned below, previously, that with fat-free mass being the primary driver of metabolism, if you can minimize the loss of fat-free mass, theoretically you can maintain a higher level of metabolism. And then in the lower panel, this represents the studies we identified that looked at alternate day fasting. And what you can see here is in all 10 of these studies, there was a significant loss of body fat, again, marked by the blue line. In 3 of these studies, only 3 actually, there was a loss of lean tissue. Now I should say in 9 out of the 10 studies, the individuals on their fasting day consumed a small snack, a 500-calorie snack. In the 1 study in which they fasted the entire day, there was a significant loss of lean tissue, which suggests to me that a whole day fasting every other day pattern may just be too much of an energy deficit for most people to maintain their lean mass. So if somebody's considering an alternate day fasting approach, I would highly encourage a small snack on the fasting day. All right, now we recently completed a time-restricted feeding study in older adults. It was a short-term, 4-week study where we looked at the effects of a time-restricted feeding pattern in overweight adults 65 years and older. And what we found was even though we didn't tell them to restrict their calories during the 8-hour feeding window, so it was a 16-8 time-restricted feeding approach, there was a significant weight loss of 2.6 kilograms. And they also reported small positive increases in quality of life as well as walking speed. Overall adherence was pretty good, where it was 84%, which meant 6 out of 7 days, the participants were able to follow this approach. And most participants said that this pattern was acceptable and sustainable. So next I'll show you the actual start-stop times of the participants in this study and highlight something important, which is that it really overall didn't matter the time they started. Almost all participants stopped eating before 8 p.m. There was one exception, but what that suggests to me is that if the goal is to shorten the eating window, the best approach to do that is to push the breakfast time up a little bit or back, however you want to think about it. But the later starting breakfast time did not lead to a later dinner time in this case, for the most part. So that was an interesting finding. Okay, so now let's talk a little bit about circadian rhythms and what impact time-restricted feeding may have in influencing circadian rhythms. And the first slide I want to show you here is from a preclinical study where looked at the effects of time-restricted feeding, a 9 to 10 hour eating window, in 2 different types of mice. A wild-type mice, which when they were put on time-restricted eating, they remained healthy, lean, and fit, but when they ate ad libitum, or round the clock, they developed metabolic disease marked by obesity, glucose intolerance. And then there's the clockless mice. This is the most significant finding of this study. These mice are known to develop metabolic disease because they have a dysregulated circadian clock. But when they were put on time-restricted feeding, they remained healthy, lean, and fit. And so that was a pretty exciting finding in 2018. And then a more recent study came out that actually looked at the effects of time-restricted feeding on lifespan and on healthy lifespan in a preclinical model. It was in male mice, but what they did was they had the mice that were put on a 13-hour time-restricted feeding eat the exact same amount of calories and the same dietary composition as mice that ate for 24 hours or around the clock. And then they also had a third group which engaged in calorie restriction. And so what I want to show you, this was done at 2 different sites with 2 different types of diets, but in both cases, the total calories were matched in the time-restricted eating group with the ad libitum group. And what you can see in the blue line is that the time-restricted eating compared to the ad libitum group lived approximately 11% longer than those rodents who consumed calories throughout the day. Now, the calorie restriction group did live the longest, but it is known that restricting calories does extend lifespan. What this shows, in my mind, is that calorie restriction is not the only way to achieve an extension of healthy lifespan. That when the animals ate the calories was also very important. And then here was a recent study in humans that looked at the effects of an alternate day fasting approach versus daily calorie restriction on markers of insulin resistance. And this was over the course of a year. And so what was fascinating to me about this study was that even though the total weight loss was not significantly different in the individuals who practiced calorie restriction versus those who practiced alternate day fasting, the reduction in insulin resistance was dramatically greater in the group that engaged in alternate day fasting compared to the calorie restriction group, suggesting that the fasting period itself has independent effects on the regulation of insulin signaling or improving insulin sensitivity dramatically more than the calorie restriction group. Now the question may be why? Why would intermittent fasting approach lead to such improvements compared to a calorie restriction approach? And I like this slide because I think it highlights the potential benefits of what we call metabolic switching. When individuals engage in periods of intermittent fasting, you again challenge the cells, which creates a host of positive changes that lead to increased levels of resistance in the cells and organs to stress. And then when the switching occurs, which happens during periods of eating or sleeping, the actual, what we call the ketone to glucose switch, there's levels, the levels of glucose and insulin now go up, but so does increased protein synthesis, cell growth, and structural remodeling. And over the long term, due to these positive metabolic changes and other biological changes, can lead to increased resilience to disease. Now, I also like to compare and contrast why I see the value of intermittent fasting as a potential treatment for obesity and metabolic disease conditions that has the potential to be more sustainable. In contrast to calorie restriction, which leads to a reduction in energy expenditure, there may actually be an increase in energy expenditure from time-restricted eating due to the activation of the metabolic switch and the conversion of fat into ketones as a source of energy. We know there's a loss of fat-free mass with calorie restriction. we don't know for sure, but it appears there's limited loss of fat-free mass following time-restricted eating. There's a reduction in fat metabolism with calorie restriction, potentially an increase in fat metabolism. We know energy needs are decreased over the long term. Potentially, energy needs would be increased with time-restricted eating. Long-term compliance to calorie restriction is known to be poor. What we really don't know at this stage is long-term compliance or adherence to time-restricted eating. But it appears more and more evidence is suggesting that this is a lifestyle that many people can adhere to. We'll get into who may be best suited for it shortly. So why are so many benefits attributed to this lifestyle? I think a big part of it has to do with entrainment of the circadian clocks, and that when you entrain the circadian clocks through practicing fasting, that can affect other lifestyle factors, your actual dietary intake, your activity levels, and your sleep, which we know have a tremendous influence on levels of metabolic regulation and lead to lower levels of inflammation, insulin sensitivity, increased satiety, lower levels of lipids, which can ultimately have a beneficial effect on reducing risk of obesity and type 2 diabetes. And of course, the gut microbiome plays a significant role in all of this. And then, although our circadian rhythms are certainly affected by light, and sunlight in particular, which can affect the central clock, what more and more evidence suggests that the clocks in all of our cells in the periphery are very much influenced by the time in which we eat. And so when we eat, we set up a host of changes in all cells in the body that can affect the signaling and what happens to the organ health by virtue of all of the metabolic changes that are associated with the feeding period. And what I think happens, unfortunately, to too many people is that they have a dysregulated eating pattern such that their calories are consumed during the time periods in which the body's resting and not during the time periods during which the body's active. And so when you consume calories and then rest, there's only one place for the calories to go if they're not being burned. And so that can unfortunately lead to poor metabolic outcomes. Now, ultimately, what I've shown you is focused in on fasting and calorie restriction as approaches to maintain health and wellness. But I wanted to put this slide up here to just put it in context that certainly the lifestyle is very important, but it's just one of many potential interventions that we could consider to target some of these biological factors that we know can contribute to chronic disease conditions and affect ultimately a person's health and independence, as well as the behavioral factors that we also know. It's much more complex than just dietary intake. It's a person's sleeping patterns, it's their medication, their psychosocial factors, environmental stress, and there's many other interventions to consider. Ultimately, I think, as an example, that combination interventions in which we combine a lifestyle with some sort of nutritional compound or obviously a dietary intervention, such as intermittent fasting, would lead to the best outcome. And this was a review that we recently published, just highlighting one example of this compound, nicotinic riboside, that could potentially be combined with exercise to lead to a host of beneficial changes that would ultimately improve physical function in older adults. And so there isn't one magic bullet, but I think it's good to think about many potential combination interventions. And then to conclude, what we know is that we have a growing population of older adults who are at risk for obesity, metabolic disease conditions, and sarcopenia. What we also know is that it's not just what we eat or how much we eat, but when we eat is an important variable to really think about in the overall approach to a healthy nutrition and lifestyle. So some areas that we clearly need more research on are meal timing. Is it better to engage in early time-restricted feeding versus later time-restricted feeding? Does it matter? That's an important question. How much protein should we take during the eating window? We know as we age, our protein needs actually go up, and it's very important to consume adequate levels of protein. So, for example, a recent study was conducted on intermittent fasting, and in this case, they reported that there was a loss of a higher percentage loss of fat-free mass in the group that engaged in intermittent fasting. And I think that in that study, there wasn't a behavioral intervention. And I think that study highlights the importance of having healthy diet combined with an intermittent fasting approach to make sure that adequate nutrition is occurring during the eating window. We also want to know how to best combine physical activity with time-restricted eating. Is there an optimal time for physical activity? And what happens if you engage in physical activity while you're fasting? Does that activate more metabolic pathways that are beneficial to health? I think yes, but we need the studies to show it. And of course, the big study that we need is really the long-term adherence. What is the long-term adherence to different intermittent fasting approaches? At the end of the day, there's likely not to be a one-size-fits-all approach, that different approaches are going to work better, for some individuals, and other approaches will work well for other individuals. And so the future, I believe, is in personalized nutrition and how to match the best intervention to the appropriate individual. So with that, I will say, well, maybe I won't, but I'll say thank you. Maybe it closed out just at the right time, but I did want to say thank you very much for your attention. And if there's any questions, I'll be happy to take them.
Thank you, Dr. Anton. That was an excellent talk. We do have several questions. I will say it in English and I will translate. ¿Desde qué edad puede usarse el ayuno intermitente para controlar la obesidad? Is there a recommended age in which it is recommended to do intermittent fasting as a treatment for obesity?
Good question. I don't think there's an age limit at this point. And if anything, there doesn't appear to be risk associated with intermittent fasting. And we should probably define what we mean by intermittent fasting. And what I mean is time-restricted eating, where each day the eating window is shorter than what most people consume calories during. And as long as nutrition is adequate, I think this type of approach could work well for adults. Again, we have the most evidence for younger and middle-aged adults, 18 to 65. What we need more evidence on is adults 65 and older. To my knowledge, the study I presented is the only study that was focused on 65 and older. But I don't know of any reason that a younger adult should not do it.
Okay. We have another question. ¿Existe alguna ventaja desde el punto de vista metabólico entre ayuno intermitente, un día sí, un día no, alternated day fasting versus time restricted? The question is there any benefit from a metabolic standpoint between intermittent fasting, one day off, one day on, alternate day fasting versus time restricted feedings?
Great question. I think it depends on the person's goals. What we know from the slide I presented is with alternate day fasting, there's likely to be a greater loss of body fat than with the time-restricted eating approach. And so if the person's primary goal is to lose body fat and may not be as concerned about losing some lean tissue, then the alternate day fasting approach would be probably the recommended approach. If, on the other hand, the goal was to maximize retention of lean tissue and to also lose some body fat, particularly in the central region, then maybe the approach would be time-restricted eating. However, having said that, what's most important is what the person will do. Because if they will not do the recommended intervention over the long term, it doesn't ultimately matter what would work best. So we always have to balance what they're willing to do with what physiologically we think would be best for them.
Excellent. Moving on to the next question. Can you comment about intermittent fasting and caloric restriction and its evidence against fighting cancer? And is there an evidence that promotes or benefits one type of fasting versus the other? Que la pregunta es que si podría comentar sobre el ayuno intermitente, la restricción calórica y la evidencia para combatir el cáncer, y en tal caso, ¿qué tipo de ayuno tiene mejor evidencia clínica?
So I think the question was, what evidence exists for calorie restriction and or intermittent fasting for cancer prevention or treatment? So that's a good question. In preclinical models, both types of interventions seem to, again, extend healthy lifespan, meaning prevent or delay the onset of all diseases, including cancer. In some cases that I have some peripheral knowledge of in the preclinical model with the fasting intervention that has been shown to, in rodents that are injected in a way that would lead to cancer, reduce the incidence of the disease progressing. So there's that. However, to my knowledge, has not been well studied in humans. And so at this point in time, it's hard to have a strong recommendation for individuals with the disease of cancer, what to do from a dietary standpoint.
Understood. Next question. ¿Está indicado el ayuno intermitente en mujeres delgadas? ¿Cuál es su recomendación? Is intermittent fasting recommended in women who are thin? And what is your recommendation?
The question is intermittent fasting recommended for women who are thin? I think, again, the reason to consider fasting is not just from a body composition standpoint. If you remember one of the earlier slides I presented, it showed all of the biology of aging mechanisms. The hallmarks of aging are all affected in a positive way from fasting approaches, from calorie restriction, and from a ketogenic diet. So I think that it doesn't necessarily matter if a person's thin or overweight, that there's some benefit, biologically speaking, from engaging in fasting for a longer period of time than most people fast. Now, having said all that, if a woman is very thin, I think it's very important that she consume adequate caloric intake during the time in which she is eating, because the goal, again, is not to lose too much fat-free mass or to maintain as much of the fat-free mass as possible. And so if that balance can be achieved, that can lead to beneficial health and body composition changes.
Siguiente pregunta. ¿Qué evidencia? I'm sorry.
Sorry, one more thing. For the thin woman, I think I'd highly recommend she consider engaging in resistance training and pay attention to the level of physical activity so that the muscle can receive the stimulus it needs to grow and to maintain the fat-free mass.
Bien, próxima pregunta. ¿Qué evidencia hay en el uso del ayuno intermitente o restricción calórica en pacientes ansiosos, ya que la imagen que reporta el espejo está íntimamente relacionada con la estima? I guess the question is, what evidence is there at intermittent fasting and caloric restriction in patients who suffer from anxiety? Being that the image in the mirror is closely ligated to the self-esteem.
Can you repeat the very last part? The image in the mirror is related to?
I guess the question is just overall, what is there evidence in patients who are anxious that maybe cannot tolerate, is there a specific recommendation?
I don't know of any studies that intermittent fasting or calorie restriction for anxiety. When we conducted the calorie restriction studies I presented earlier, we did not see any negative changes in depression or anxiety following the calorie restriction regimens. And to my knowledge, there hasn't been any negative reports following the time-restricted eating patterns on changes in anxiety or depression. But I don't know of any studies that have indicated improvements in anxiety from practicing these dietary lifestyle changes.
I have a personal question because I think a lot of people are into this intermittent fasting. Can you explain? I think you've shared with me that you also fast. What are the common symptoms that people feel, during the first days? Is there has been any strong evidence of, what are the most common findings or what patients refer? La pregunta es, en cuanto al ayuno intermitente, ya que está muy de moda, ¿qué tipo de síntomas más comúnmente refieren los pacientes? Porque entiendo que no todo el mundo tolera o es capaz de mantener este tipo de ayuno intermitente a largo plazo, que sería interesante que nos comentara su experiencia acerca de qué tipo de sintomatología o signos experimentan estos pacientes.
Very good question. And what I didn't talk about too much is actually how to do this and how to change from eating, let's just say 12 or more hours per day to eating 8 or less hours a day. And I think it's very important that anybody who's considering this recognize that it's a process, that it's not a good idea to go from eating the way most people are eating to trying to go to 8 hours quickly. The body needs an adaptation period. Otherwise, symptoms could occur such as headache or dizziness, lightheadedness, fatigue. These are signs that too much stress is occurring and that it's probably best to go slower. And so what I recommend to almost everybody is to take it one step at a time. Maybe extend the fasting window by a half hour or an hour, depending on how the body reacts, and then see how that goes for about a week. And then maybe the following week, extend it by another half hour, and slowly allow the body to adapt, because otherwise it can cause, again, too much stress, which can lead to symptoms. And I liken it to exercise. If your body's able to run 1 mile, it doesn't make sense to go try to run 5 miles. What makes sense is to go to try to run 1 mile and a quarter, to try to push the body a little bit more than it's capable of, not to the ultimate goal. But over time, I can tell you that study shows that people can adapt to this type of eating regimen. And my own personal experience has been that too.
Excellent. Moving on to our next question. We have 2 more questions. ¿Cuál es el efecto del ayuno intermitente en el apetito? This is a great question. What is the clinical evidence that has been shown about intermittent fasting on the appetite, satiety? I know there was a study that was published in the New York Times once when these people, they fasted and they did intensive diets that metabolism slowed down. So is there what is the clinical evidence on appetite, satiety, or like energy expenditure?
It's limited in the time-restricted eating approaches. That is what is needed. I think too much of the studies have focused on body composition. And one of the things, though, I will say in terms of total energy expenditure, that it appears is that there's less of a reduction in total energy expenditure following time-restricted eating. But again, there hasn't been careful assessments using metabolic carts to really assess overall metabolic changes. In terms of appetite, again, we really have much better data in calorie restriction than we do for for intermittent fasting. The study I showed was, again, it was a small study, but we did ask about changes in hunger. And for the majority of the participants, they did not report dramatic changes in hunger following the time-restricted eating pattern. But I'm not aware of other studies that have carefully looked at changes in appetite following time-restricted eating or alternate day fasting. We did one other study where we did do alternate day fasting in middle-aged adults. And I can tell you it depended on what day you assess the appetite. If you assess the appetite on the fasting day, it was very high. However, on the day in which they're able to eat, very few people could eat sufficient calories on the feeding day to compensate for the energy deficit that was created on the fasting day. So even though appetite was up on the fasting day, it was not sufficient to lead to adequate calorie intake to not produce weight loss, to lead to weight loss, or to lead to weight maintenance. Yeah.
Bien. And we have one final question. ¿Cuál sería para usted el mejor esquema de ayuno intermitente? A great way to close the talk. Being an expert on this, what is the best way to do intermittent fasting in your experience? What would you recommend?
Oh, that's such a good question and a hard question to answer from a blanket standpoint, but I will answer it. And what I would recommend is probably what I said earlier. For most people, I would recommend trying the time-restricted eating approach. And that's because it's a little bit more forgiving and a little bit easier to start with than an alternate day fasting approach or a 5-2 intermittent fasting approach. And so in this case, you have the ability to determine what eating window really works well for you. And it doesn't have to be 8 hours. The 16 8-hour time-restricted eating approach that has become so popular is not based on any one study. There's studies that show, for example, a 10-hour eating window can produce similar metabolic benefits. So I think what I would say is consider starting with that approach. If you enjoy the fasting period and it's tolerable, then you can consider extending that time. And when you do that, if it's easy enough to extend to dinner time, then you've almost engaged in a 24-hour fast. But again, I would not advise anybody to try to do that right off the bat. So I hope I'm answering the question.